Good afternoon, everyone. I'm so glad you could join us today for our staff teams live event. We have quite a lineup here for you and lots of information and then plenty of time for questions. I just wanted to start out by thanking all of those who were involved in our transfer of our students in Mercy Hall to other location at CCHR and really helping us manage the need for quarantine space. I really appreciate it. It was a lot of work and students were wonderful, but staff were incredible. So thank you for that. And I know you're going to hear some really exciting things that are going to be happening, but just a big reminder, one of my favorite activities, Blackboard Jungle Symposium, it's number 13 this year, is going to be March 23rd through March 26th. I hope everyone will join me in those virtual events. I wish we could be together, but I know we're going to have some really wonderful conversations and great people who are really working towards focusing on reimagining an inclusive community. Also, you probably just got the message about employee wellness, and I know we have Mary Brodsky here today, and she's going to be talking about that as well. But it will be featuring Laura Putman, who's going to be talking about becoming our best selves. And I've actually gone online and looked at several of her videos, and she's quite something, and I have the privilege of introducing her. So I look forward to hearing what she has to say as she gives the series of 1-hour lunch talks, and she's highly energetic, and I think you will enjoy very much her talks. And so join us on March 16th for that. So I'd like to just talk about who's here today and who is going to be sharing certain information that's going to be important to you. So if we could go to the next slide. We have Gary Durr, of course, who is our VP for Health and Safety, and he's going to give us the COVID-19 context and really giving us some updates on testing and quarantine and isolation. Thank heavens for Gary and his team. And then Bill Falls, we're happy to have as our Dean of the College of Arts and Sciences, who's really been leading the way for our Faculty and Academic Affairs subgroup of the spring planning group, and he's going to give us some updates on the spring course framework, what we're going to do in the summer, and student space update. And then Erica, our new Vice Provost for Student Affairs, is going to tell us a little bit about student life. She has some information about the decisions we made about sanctions and programming and how we're trying to support the students and how they're using the tents, and of course, my favorite, the ice rink. And then Mary Brodsky, who's in our HR group, and we love Mary for all the things that she does to support us, but she'll be giving us some wellness updates and some updates on mental health, and we'll probably also talk about Laura's presentation on March 16th and what's happening for Blackboard Jungle. And then, of course, we have John Paul Grogan, who's also going to talk about student support for mental health. And then Tessa Lucy and Francis Churchill, they have lots to tell us about some campus safety and our resumption to work plans and health screening and some updates on double masking, and then of course our dear Julia Russell, who makes sure that everything works with Simeon's team and others. I know I'm teaching this semester, as many of you know, and thank goodness for technology, and when I have a problem I just call up and they take care of it. So thank you so much for all the work for all of our people in ETS. So on that note, I'm really delighted that we have President Garamella here with us, and I know he has several things that he would like to just share in his appreciation for the staff and all that you do. So go ahead, Suresh.
Thank you, Patty. That's quite a lineup, and I will be listening to what's being said. But let me start with a huge congratulations for this 50th anniversary of Staff Council. This is a huge milestone that I look forward to celebrating with all of you. Even though I've been president for just over a year and a half, I've seen how well Staff Council represents the interests of staff and how positively and productively Staff Council has worked with me and other members of the administration to bring issues to our attention and to offer partnership in thinking about solutions. So stay tuned for news later this year about a celebration of your 50th, when we can do so in person, hopefully by late summer or early fall. I want to thank you all, our staff, for your continued support and dedication for all you do during these challenging times. I know that our staff and their families have had their personal lives upended as well, and this contributes to a stressful time for all. COVID continues to cause anxiety and stress in our community and across the nation. With our student positivity rate of 0.5%, 0.5%, compared to 1.5% for the state, we're still among the safest campuses in the nation, but we're increasing our diligence with twice weekly testing for a few weeks, stricter enforcement of sanctions, and more quarantine space provided. Our regular testing of all students ensures that we get those who test positive into isolation before they have symptoms. And remember, UVM's response is not a single strategy. It's a combination of multiple strategies that includes testing, contact tracing, supportive isolation, quarantining, all of that. Let me also offer, like Patty did, a special appreciation to the staff involved with assisting with students in Mercy Hall and preparing that space for additional quarantine capacity. We should all continue to stress the big three actions we take that remain the same: wear a mask, wash your hands, stay 6 feet apart, and I guess I'll add a fourth: avoid gatherings, even in small groups. As you know, testing is available free of charge, and I think in a very convenient offering to all faculty and staff. I'd sincerely encourage you to test regularly too, for your peace of mind and to keep our community safe. I want to leave you with a quick reminder of what Vermont Health Commissioner Dr. Mark Levine said. I quote, "Our public health response won't change, but we do need to strengthen it, encourage better fitted masks, strict adherence to physical distancing, and keeping social contacts to as few as possible." We should all do this. Let's all see ourselves safely through the end of this pandemic, which I hope is not too far off now. Thanks again, and I'll turn it over to Gary now, the person who keeps us all safe. Gary.
So thank you very much, President Garamella. I think we all have been closely watching the numbers, both our campus numbers and the numbers in Chittenden County and across Vermont. And there are encouraging signs, particularly in the state numbers, that things are improving. As you notice, if you follow that, it goes up and down over the days, but it is at least heading in the right direction. What's also encouraging, and the number I last saw was earlier this week, that about 15% of the Vermonters have been vaccinated already. When we started spring semester, I fully anticipated that we would see a larger number of positive cases than we saw in the fall. There are a number of reasons for that. It was much more prevalent in the community, both in Vermont and across the Northeast when we started spring semester. It's also harder because we started spring semester with people needing to be indoors a lot more than they were in the fall. We started fall with some fantastic weather and people were able to be outside a lot more than they've been able to be in the spring semester. So we fully anticipated that. And that's why, if we can move on to the next slide, I want to remind what the president said. You know, people keep asking me, what new should we be doing? What differently should we be doing in light of whether it's the new variant, the new strain, or whether it's the increased number of cases in Burlington, Chittenden County, or even on campus? And the answer is very simple. It's the same thing. It's wearing face coverings, wearing good fitting face coverings. People have asked about double masking. We'll be talking about that. Maintaining that social distancing that we have, keeping that 6-foot physical distancing, and then the hand washing and personal hygiene. And as the president mentioned, also, it's so important that we limit our social gatherings. I know we've all want to get together and spend time with family and friends together. We're almost there. We've almost put this behind us, but we got a little bit further to go with that. And then just continue to remember to follow the state travel guidelines. We update our website with the current information. We try to stay atop of the changes that the state announces, but we need to maintain that commitment to not traveling, to blending those two households, whether they're in state or whether they're outside of state. The other thing that I think we have done really well is our contact tracing and symptoms monitoring. We'll talk more about what employers are doing, but also Our student health services folks have done an amazing job in providing support for our quarantine students and our students in isolation, but also doing a very, very comprehensive contact tracing program. As the president mentioned, we announced yesterday afternoon that for a period of time, for the next 2 weeks, we're going to be implementing twice-a-week testing for all of our students. We recognize that this is a challenge and we want to be as supportive as possible with that, but we saw this as a way to get ahead of what appears to be a little bit of an uptick on campus this spring and to bring that into control. We've been encouraged by the numbers this week, but we saw this as just a way that we can add a strategy in this. This is the decision that university made. It's continuing what has been our longtime practice of a containment strategy built closely with testing. We've been discussing this in partnership with our Vermont Department of Health, as well as city and state leaders on this. And we'll be reassessing it as we go over the next 2 weeks to see if we can manage that. One of the encouraging signs that we've seen in the last 2 weeks is that we have seen a number of our new positives actually come from students who have already been in quarantine. So why is that important? That's important because our students are already limited their exposures because they're in quarantine already. So we don't have as many trailing contacts there. As we've mentioned already, we've significantly expanded our quarantine housing options on campus as well as our isolation. So we never reached capacity. I know some people raised questions whether we did. We never reached that, but felt that we were getting a little bit close, that we need to come up with some additional space. So if we could move to the next slide. I really think it's important to know, and I give a big shout out to particularly our students, but also our staff who have been doing testing. We have done over 250,000 tests at UVM since this started. This month alone, we've done over 40,000 tests at UVM. That's truly remarkable. That number of tests that we've administered represents 23 to 25% of all the tests that have been administered in the state of Vermont. A lot of questions have been coming up about vaccines. We're going to be providing some information updates on our website, particularly about travel and about other one of those changes. And I really encourage you to go to the Vermont Department of Health website. They've got a lot great information about the testing strategy. And now that we're 65 plus age group in there, it seems that it's been going very well. So with that, I want to turn it over to my colleague, Bill Falls, for an academic update.
Thanks, Gary. Good afternoon, everyone. I just wanted to give you a brief update from Faculty and Academic Affairs. The Faculty and Academic Affairs group continues to meet weekly, addressing issues that are coming up regarding this current spring semester, which is hard to believe we're 4 weeks into, and also turning our attention to what this summer will look like and what next fall will look like, and perhaps at some future staff update meeting we can give you some sense of that. But I want to focus a little bit on the spring and just call to your attention two important things. One is that the spring final exam schedule has been created and posted. I want to give a shout out to the registrar's office, who had to work really hard with some challenging conditions to schedule all of the in-person final exams. Social distancing has produced a bit of a struggle for in-person classes, and so working with mixed modality courses, the registrar had to work hard to find spaces where we could accommodate in-person final exams. So a shout out to them for some great work. I also want to call attention to the fact that if faculty have a health status change and they need to seek a temporary change in their course modality, they can find a form for requesting that on the provost website. So in case faculty come to you and ask how they can go about doing that, you can point them to the provost website. Summer University, we're thinking about summer, and registration began back on February 18th, and it's going really, really well. The vast majority of our summer courses are going to be online. We have only about 35 courses that will be in person this summer, mostly lab courses, things that are really challenging to do in an online or remote environment, but Summer University is well underway. And then lastly, I just want to talk a little bit about student study spaces, and if I could have the next slide. A lot of folks contributed to identifying spaces around campus, and there are 9 of them identified here where students can go and find a little quiet space, socially distanced, to engage with their classes or to study. So this interactive map is available through the Center for Academic Success. So just, go ahead to the Center for Academic Success if you want to see where those study spaces are, or just go on to UVM and search study spaces, and it'll bring you to this website. So thank you for all that you do, and I'll look forward to giving you an update on how the spring is progressing, and summer, and maybe a little bit about fall next time we chat. So I'll turn it over to Erica, our Vice Provost for Student Affairs.
Thanks, Bill. Students are the heart and soul of our campus, and so much of our purpose connects directly to their learning and growth. So I want to share a bit about where we are by way of some updates pertaining to the student experience. We listened to student and family requests for information, and we created a website dedicated to preparing and supporting students who might need to quarantine or isolate. It's intended to both let them know the logistics of what to bring and how it works, and also respond to their desire to know what the experience there might feel like. Ultimately, we would like to see fewer students needing to quarantine and isolate, and to really underscore the need for students who are not abiding by the Green and Gold Promise to change their behavior. We have, as you know, we've let students know that effective immediately, Green and Gold Promise violations will be reviewed for suspension. Until now, students found responsible for violations would receive other sanctions first, and this change was not an easy decision to make. But this particular moment in the pandemic requires a firmer stance with respect to protecting campus and community health. We know that many students are doing their part, and they deserve to have the opportunity to continue the semester in person. We're not seeing the virus spread in structured and distanced spaces like classrooms and dining halls. We are seeing transmission when students gather together in residence hall rooms, for example. The great news is that there are many options for in-person and virtual gatherings. As you know, students are enjoying the tents, which have Wi-Fi and heating and distance seating that's both comfy and table space. We have a lot of programming, again, in person and virtual. And I'll mention a few of those offerings, and also recommend that those of you who might be curious to learn more visit the UVM board website, where literally hundreds of programs are listed. So again, in person and virtual, ranging from film screenings, fashion shows, counseling, soccer, cycling, yoga, fitness, affinity spaces, knitting, game night, pub quiz, rock climbing, dietitian consults, study abroad info sessions, all kinds of things. Civic Engagement is kicking off its social justice grounding retreat series this weekend. Rallython, which, as you know, raises money for the Children's Hospital, is in full swing. Yesterday, they significantly exceeded their goal. This evening, there's a cool online talk about owls through the lens of culture, but also through the literal lens of bird watchers. I mean, really just a lot of programming. And that said, we recognize that the pandemic weighs heavily, that it's exquisitely difficult for students who recognize in their peers potential lifelong friends, and we're asking them to distance. We know that there are a couple of reasons that explain why so many lasting friendships form in college. There's the opportunity to get together spontaneously for extended periods of time and engage in significant personal disclosure and sharing. And we know the need to distance during the pandemic makes that really hard. There's a real impact on students. So with that said, I'd like to ask John Paul Grogan, the director of our Center for Health and Wellbeing, to talk about student mental health.
Hi, everybody. It's good to be with you this afternoon. Like Erica said, my name is John Paul Groban. I work in the Center for Health and Wellbeing, and I currently lead our teams that are really focused on education, outreach, and prevention, and our clinical mental health counseling and psychiatry team. So, I'm really here to talk about what's on the mind of many of us right now, as Erica mentioned, which is supporting the mental health and well-being of students as we navigate the impacts of a pandemic that is in the third semester in the life of our campus. And my hope for my time, at least with you today, is to offer some context for where we are now, to highlight some resources and to talk about what we're trying to do as we move through the semester. So I'll start with grounding us in some big picture content, which is that rates of anxiety and depression have risen on college campuses in recent years, and we're no exception there. The news is reminding us on a daily basis that the pandemic is impacting the mental health of all of us, young and old, in many ways. And though I'm here to really talk about students, it feels really important to name that we're all being impacted in this regard. We know that the pandemic has disproportionately impacted our BIPOC community members, that this impact has been compounded by traumatic national events this year. In the past year, we know that college students face a unique set of challenges. In-person opportunities are limited, there are financial stressors, and there are lots of feelings of disappointment from simply not having the UVM experience that they had expected. We can layer on that the fatigue of remote work and screen time, navigating fears about getting sick and spreading the virus, and for many, the direct impact of loss. And I know that list is not conclusive. So that's just some big picture context. And if we can go to the next slide, I want to talk a little bit about what's our campus context. What are we hearing from students right now? And here we've gathered some themes from staff in a number of areas across campus, and we've tried to bucket these a little bit into themes. But this idea of starting with a deficit, we had a long break. We hope students would return rested, and a lot of students didn't simply, and that there's some early fatigue from COVID protocols. For many students, that extended break was a challenge. Being at home is not a great situation. For some students, they're missing that support and some of those social connections they had at home. I think we're all, staff and students alike, missing some of those familiar anchors and milestones of the semester, some of those traditional events and the way we expect them, and really timing. We're barely here, and we're talking about summer, and we're talking about housing for next year, and so a lot of our campus rhythms are different. Not surprisingly, students describe this tension between, wanting and needing to connect and how to navigate distancing and risk. We know that certain groups of students, particularly BIPOC students, feel like they're missing adequate support. Some are missing resources. This theme of something that's missing has come up in multiple places. Not necessarily that students are bored, but that they're missing some of those intimate connections that they often have, across campus, student, staff, and faculty. And finally, we'll name this sense of brewing anxiety. Students know that there's not a spring break. They know that there are challenges in how to navigate the COVID pieces, whether that's with conversations with roommates or worries about needing to quarantine or isolate. So a lot of things that we know are on the minds of students as they're really trying to learn and have this growth experience. So we can go to the next slide. So, just to kind of give you some indicators, many of you likely saw an article that came out in the Chronicle in the fall semester. We know that utilization of nationwide of college counseling centers went down a bit. It feels important to name that we saw some of that here on campus, most notably in the spring semester as students left campus. We're certainly seeing utilization picking up as we start in the spring semester. We know there's a decrease in overall care forms. It's not on this slide, but I also understand that Student Accessibility Service is seeing increased needs for academic accommodations. We're seeing increased need for use in the Rally Cat cupboard. And I also say in terms of data that we gather, our screening tools are capturing, some mild increases in anxiety symptoms and increased indicators of low mood in our student population. So, so what do I want you to take away from that? That we know students are struggling. We know that they're using less of some of our support services. We know that there's less outreach happening in the ways that it normally would through the care team. And we know that just by nature of what campus looks like right now, there's fewer eyes on students to refer, share concerns, to connect them with those helpful people and resources. And, I often say this whole thing works because of the web of supportive touch points and caring people from across campus. And we're all still here, but it looks different right now. We can go to that next slide. So I want to highlight some key resources and why they're important right now. And I'll start with clinical health resources. We've done a lot of work to make sure that we're ensuring rapid access to these things. Particularly counseling and psychiatry services, behavioral health, and medication needs at student health services. Particularly for CAPS, we've really focused on trying to get students connected with a person the day they call, and if not, the next day. So we're really trying to be accessible and available, and that goes for students that are here and at home. So just a reminder, to you all, if we're telling students regardless of their location to call us, and we'll talk about what's available to them or how we can support them regardless of where they are. It feels important to remind our university event services staff did some great work around creating some private telehealth spaces for students, whether they're using our services or services at home. There's information about that on the Center for Health and Wellbeing website in terms of how students can reserve those spaces in the Davis Center. I always make a plug for our academic dean's offices and student service offices in terms of folks that are really adept at supporting students and navigating systems as it relates to their academic experience, along with our Res Life Pro staff. I know we all know about it, but I always put the care form on there to remind you all that if you have a concern about a student, please submit that form. There's a group of staff that are here to respond to those and support you in how to respond to those. I put our Center for Health and Wellbeing board link on there. I think that's particularly important because it holds the menu of all of the sort of drop-in self-serve options that are available to students, and once again, regardless of where they're located. And the last thing on that list are emergency contacts. We have done a good job to make sure that those are visible on the LiveSafe app, which if you don't have or aren't aware, that was rolled out to students in the fall. I encourage you to check it, to download that as a staff member, and also our Health and Wellbeing website, where we have lists of emergency resources on campus that include how to contact all of our on-call supports. It also shows students what state and national text and hotline numbers are available to them. So we can go to the next slide. So where do we go from here? What are we trying to do? There are a lot of folks on campus that have put a lot of thought into some supportive messages to communicate to students, and I really want to appreciate the work of the Center for Health and Wellbeing and the DOSA Communicators Group and our university communications team to really put out some messages that we hope will speak to students right now. And to reiterate, we want these messages are really targeted at wanting students to check in with themselves, to check in with one another, to ask for help, to look out for others, and really to normalize that this is just hard right now. And so that's really our intent and our focus there. We can go to the next slide. So once again, here's some more examples of some of these messages and signs that are being put out there. These are appearing widely right now on social channels as a recurring part of UVM Strong emails to off-campus students. We're working on some student communications through the Center for Health and Wellbeing, through SGA right now. We're adding information to websites. We're adding this content to my UVM, and we've also made all of these resources downloadable and available to staff across campus. So capture that link and we can add it to the chat later. And I put the Center for Health and Wellbeing email address on there, health@uvm.edu. If you have other ideas or if there's some way we can work with you to support or reach students, we'd ask you to reach out. And I think I have one final slide, if we can advance, which is just to speak a little bit about what we're hoping to achieve, which is at a bare minimum, we want to encourage students to use the great resources that are out there, to direct them to the clinical resources if they need them, to other professional resources that are here to help. We're trying to encourage students to do the things that we know will help. We often talk about the thriving model, which seems a little presumptuous right now, but still want to encourage students to find this reasonable minimum of things that they can do in those thriving areas, like learning and connection and playing and taking care of your physical body, like enough sleep, the right amount of exercise, eating well, and other things like being of service and finding meaning. And so really wanting to encourage, what's the behavioral piece for students. And then finally, it's, thinking about this building on our culture of care and how do we activate that. And we're broadly working on a lot of communications. My gut tells me that what students are looking for are a lot of those personal and caring connections with us as a staff. And so, really my ask of you and what I hope you'll think a bit about is what we can do or what you can do that helps get students through the next few weeks. We all know that students find some momentum as we get towards some warmth and sun and into the semester and hopefully some better times ahead. But I'm worried about the next month, to be honest. And so, my humble ask really is, are there places you can use these materials, these messages, this content? Are there students you can reach out to? Are there groups of students you can reach out to? Can you provide or direct students to in-person opportunities for engagement? Maybe can you provide some of those opportunities? Ask yourself, are there students that that need a connection to a campus resource? Ask yourself, are there other creative things we could support you in doing to help students? And so, I say all of those things knowing that we're busy and that there's a lot on our plates, and to name that these are all things that we always do. And my ask is to simply ask you as staff to pay some additional attention to where you might do some of these things in these critical weeks ahead. So I'll stop there, Mary, and pass to you. Thank you, everyone.
Thanks so much, John Paul. What you were saying about the culture of care for students, and I would extrapolate that the messages that you put up really resonate with our campus community in general. This is hard and we need to take care of ourselves and we need to take care of each other. And I think that those kinds of outreach, please outreach to the students, please outreach to one another. We're all in this together. And, you're juggling a lot of things at once, but we want to be able to recognize that. And to take those moments, which leads me right into thinking about how we are expanding ourselves as staff. And I'm pleased to be able to share the news that our Professional Development and Training Office, in partnership with Staff Council and our wellness program, is launching EDU at UVM. So many of you know that EDU at UVM is an annual conference that staff looks forward to every year. But in planning for it this year, our professional development and training team took a different approach. They've structured the conference as a series of learning workshops, 2 per week, beginning in mid-March through the end of April. I don't think anybody wanted to think about having Microsoft Teams or Zoom fatigue and being in days-long conferences, even though the content is really fantastic. So this year's theme is work life in the time of COVID. And Provost Prelock, as she noted in her opening remarks, she's graciously agreed to launch this series with wellness speaker Laura Putnam, who will share her reflections on how we can become our best selves. Other workshops that are going to be offered include parenting during the pandemic, ergonomics at home, and a series of best practices for working and supervising remotely. We hope that the EDU at UVM sessions will help staff develop personal and professional resilience as we all continue to operate during these extraordinary times. Registration opens online on Tuesday, March 2nd, and all of our workshops are free. Supervisors are strongly encouraged to allow staff flexibility within their workday so they can participate on duty time. We mentioned at the beginning about one of the university's signature events, which is the 13th annual Blackboard Jungle Symposium, which is being held the week of March 23rd. It's such an important event, and it's really incredible to have space to participate in critical conversations about inclusivity and diversity. I'm personally interested to hear the perspectives of the keynote speakers, Dr. Eddie Cloud Jr. and Judy Shepard. We've just begun our spring semester, and we're coming up on an anniversary that none of us imagined we'd hit. On March 13th, it will have been a year since Governor Scott declared a state of emergency in response to COVID-19. Please remember that UVM's Employee Assistance Program is not only for employees in crisis. EAP offers support and resources for you and your immediate family members on matters as varied as stress management, to building better relationships, to financial management, to finding better work-life balance. Lastly, a note about staff performance reviews. These last 12 months have wrought changes and challenges we could never have foreseen. While we never wavered from our mission to ensure student success and quality experience, the reality has been that our operational priorities and goals have often shifted out of necessity. So in considering how we were going to approach performance reviews this year, the last thing we wanted to do was to create more stress or anxiety for staff. We also saw this as an opportunity to define a campus-wide evaluation period, which will align with the faculty cycle and the calendar year. So in short, for the 2020 review, supervisors should assess performance for the period from the date of the employee's last review through the end of December 2020. These assessments can be done verbally or in writing if people prefer that. We've opened the people admin system for staff and supervisors to acknowledge that the 2020 review has been completed. This is not supposed to be onerous. This is supposed to be a conversation with employees and supervisors about what's worked well, what they are looking forward to, what they might need to improve, what they've done exceptionally. And the next performance review cycle, during which written assessments will be required for the next round of the cycle, that will cover the period from January 1st, 2021 through December 31st, 2021. And so that cycle will then be open in January and February of 2022. So this will help us transition to a common cycle, which I hope is welcome to folks on campus. If you do have questions about this, please contact HR at uvmler@uvm.edu from a performance management perspective, or if you have general HR questions, you can contact hrsinfo@uvm.edu. Thank you very much, and I will pass it off to Tessa Lucy and Francis Churchill for health and safety.
Great, thanks, Mary. I also want to say thank you to John Paul. Those were great messages about emotional and mental health and well-being, and all of what we talked about, and Mary also talked about, for students really affects employees as well. So I think I'm going to start with an inhale, a pause, an exhale, and a pause, and a reminder to be kind to ourselves and each other as we go forward. But that's not what I'm here to talk about. I'm here to talk about our operational plans. And Louis Pasteur told us that fortune favors the prepared mind. And one of the many keys to our success has been the preparation you all have put into your planning and then implementing those plans so our minds can be prepared. And our springtime operations plans are well in flow. We have almost 90 approved plans. We have about 40 that are currently being reviewed, and 30-some that have yet to be submitted, and we'll be reaching out to those departments. A reminder that these plans really are based on the general guidance, and that general guidance is masks on faces, 6-foot spaces, and uncrowded places. Where that general guidance is insufficient, that's where we need the specific plans. And some people have submitted specific plans that are from the fall and current that work just as well in the spring, and other departments have had to update those. If you have any questions about the operations plan, please submit those to uvm.strong@uvm.edu. The other thing I want to talk about is masking and double masking. A reminder that wearing a face covering is required on campus whenever you're around others and in spaces where you do not control the access. So many classrooms, break rooms, hallways, things like that, masks are required. Masks have to be made of 2 layers of material, and they have to cover both the nose, I don't know if you can all see me, and the chin. And they have to fit snugly. And I'll speak up because I'm speaking through my mask. We've heard a lot about double masking, and double masking, while not required, it can be very useful. A double mask is just you put one mask on, and then you cover it with another mask. Again, covering the nose and the chin and trying to ensure a snug fit. So generally, cloth masks can be worn over a disposable mask, but you might find that it impairs your vision, or the increased resistance in breathing is difficult. If that's the case, please do not double mask. But other than that, double masking is allowed, but not required at UVM. And now I will turn it over to my favorite compliance officer, Tessa Lucy.
All right, thank you, Francis. Unfortunately, I don't have any props, but I would first like to just thank everybody, as others have said, reiterating the big thank you, because this hasn't been easy. It's not over yet. The light at the end of the tunnel, it sure seems like it's getting closer, though. But so start out just by thanking everybody for all your help and your attention to all the health and safety measures. So my part of the agenda today, I want to talk to you about the daily health check-in form. As most of you already know, if you're working 100% remote, you don't have to fill out the daily health check-in form. But if you're not 100% remote, you need to fill it out every workday, even if you're not coming to campus for that day. So for example, if you work remote Monday through Thursday, you're only coming in on Friday, you still need to fill it out Monday through Friday. If you have any questions about what it means to be 100% remote, we do have a guidance document specifically on that. It's on the employee guidance page, and I've put the link to the employee guidance page on our slide here. Just a little plug for that page. We do have other guidance materials on there as well, so I recommend that you check it out. We talk about things like academic classroom guidance, common area cleaning, face coverings, a whole bunch more. So check out that link if you get a chance. What I really want to talk to you about today as it relates to the health check-in form, it's about the functionality and the messaging. So first of all, the daily health check-in form is for employees, faculty, and staff. The Co-Verified app is for students, and we have received many questions about this, that if you're an employee, it's not an either or proposition. You have to fill out the daily health check-in form. If you choose to fill out the Co-Verified app, that's fine. There's nothing that's going to stop you from doing so, but you also must fill out the employee health check-in form. And I've also put the link to the form on this slide as well. So part of the reason that it is so important for employees to do the health check-in form is because of the way that we've designed it. And we've designed it in such a way that it not only complies with the state requirement, which is that all employees complete a health survey prior to arriving at a work site, it also allows us to communicate changes to both the state and university requirements around areas such as travel and quarantine that were mentioned earlier. As anyone who's been working on site knows, our check-in form, it's more than just, do you have these symptoms? Do you have a fever? It gets into much more detail, and the design of our health check-in form was very intentional. What we do know is that both the CDC and the Vermont Department of Health, they're going to continue to update and change their guidance as the situation evolves. The governor is going to continue to make updates to the stay home, stay safe orders. And as he likes to say, he'll open or close the spigot based on data here in Vermont, the US, and globally. All of this means that the Health and Safety Committee, we also need to make sure that the employee check-in form is current and updated, and that employees, which is all faculty and staff, they need to be paying attention to what it says on the form. So my first message is, don't just fly through the check-in form assuming that every day it's going to be the same questions, the same responses. When you submit your daily health check-in form, make sure you're reading the questions, you're answering them, and then following the instructions that pop up when you submit it. To be clear about some of the governor's orders changes, not every change at the state level automatically means that we implement it here at UVM. It really depends on what the change is, how that affects our entire community. Sometimes it might take us some time to operationalize and implement the change. It may be that the state's general guidance and the guidance from the state conflicts with one another. So what we have to do is really balance all of these requirements with what's best for our campus community and with the health and safety of our students, our faculty, staff, and community. Just as an example, last week at the press conference, Governor Scott addressed the multi-household gatherings for those who have completed a full cycle of the vaccine. So a full cycle of the vaccine means that for the 2-dose vaccine, it's 2 weeks after the second dose. And if we start seeing the new single-dose vaccine, it would be 2 weeks after that dose. In response to the change, the state guidance got updated, and now it allows for, or what it reads is that multi-household gatherings, indoors and outdoors, in public and private spaces are prohibited for individuals who are not vaccinated. Vaccinated individuals or households may get together with one other vaccinated or non-vaccinated household at a time. So really, this is great news for folks who have been vaccinated. It's encouraging for all of us. However, the guidance that applies to universities has not yet been updated. So I use that as an example just to illustrate the state may say something's okay over here, but not over there. We think that we'll get there, but until they do, I want you to know that from the back end of things, a lot goes into planning, operationalizing these changes. They may not happen overnight. So, for example, the multi-household gatherings as it relates to vaccines, we are working to update the form. So we'll have a separate question about vaccines, but that takes some time to make sure that all the programming works and that we're still able to get the information that we need. So really what I want to make sure everyone hears from the message is that as things loosen up, when the spigot opens, we'll get there. It may take us a little time to implement everything that needs to happen. And I've in other meetings, I've heard others say this, and I think the analogy is very perfect, that we shouldn't be thinking of it as, how can I do this for another 3 months? We should be thinking of it as, let me just take it 1 week at a time. So once we can safely open our own spigot, we're going to do that, and we're going to do it as quickly as we can. I guess, really ultimately everything that I'm trying to say here is that we can be encouraged with the way things are changing, but we still have to be cautious. If you're not sure what our current policy is, you'll know when you fill out the check-in form. If you're a 100% remote employee and you're not filling out the form but want to know what the current policy is, contact your manager, supervisor. You can always email uvm.strong@uvm.edu. And just, really ultimately, big message here, when you're filling out the form, pay attention to the questions, pay attention to the instructions, because they may have changed. So with that, I'm going to hand it over to Julia Russell, our Associate Chief Information Officer.
Thank you very much, Tessa, and thank you everybody for being here. I've got just a couple of IT updates that I wanted to give this afternoon, a few takeaways for you that you might find advantageous in your work. The first thing that I wanted to draw to your attention today is a new tool that we have for delivering software. It's a tool called Apps Anywhere, and it takes the place of the old software download page that some of you may know, only it's much more powerful. And in addition to allowing you to download software to your own laptop, it also allows you to run software that may not be appropriate for your particular machine. So as an example, if you're a Mac user and you want to make use of software that's typically only available to Windows users, in the past you've had some hoops you needed to jump through in order to make that happen. Apps Anywhere makes it a lot easier to get your hands on software that you may not have been able to run before. It's a tool that we've had since the fall, and we're continuing to update it and make new software available through the interface. But it is new, and if you haven't had a chance to take a look at it recently, I really encourage you to take a look, see what you can get access to that you might not have had a chance to use before, and see what might be available that you can use in your work. The next two items that I wanted to touch on briefly are about Teams. So some of you may already be aware that Teams now provides breakout rooms. This was a really big deal, particularly for faculty, where they were wanting to be able to take their class and spin them off into small groups for discussion, pull everybody back together. But I wanted to draw it to your attention too, because it may be, we were talking earlier about how, you know, some of us have Teams fatigue. We're spending so much of our time in Teams meetings. You may find that something like breakout rooms or something like some of the other Teams features that are new allow you to run your meetings in a slightly different way. Maybe you can break up some of the I don't want to call it monotony, but the common rhythm that you would typically have for a Teams meeting. Maybe there's a different way that you can take advantage of the tool. So I'd encourage you to check out the knowledge base. There are ideas there about how you can use breakout rooms. There's information on all the new things that are coming in Teams as it's available. Might help you just kind of change your rhythm a little bit and do things a little differently. And then the last thing I wanted to bring to your attention quickly, I think many of you realize that Teams does allow you to use virtual backgrounds in your meetings and in your presentations. If you're looking to add a little UVM spirit maybe, or you want to give a little bit more professional feel to your meetings and presentations, we do have some knowledge base articles that both will explain how to use the virtual backgrounds, but also will provide some links to some new images. So for instance, the one I'm using right now comes from the UVM Foundation. They have some really nice things there, some seasonally appropriate photos that are just really quite nice. So check those out too, and you may find some things that you like. So I know we're approaching the top of the hour. I'm going to turn it back over to Patty here, and we'll wrap up.
Thank you all. Thanks, President Garamella, for your leadership as we navigate this pandemic. We might have time for just a couple of questions, and while I'm waiting for a couple of those to come up, Gary, thanks for your diligence in keeping us safe. Bill, ensuring that we're providing a quality academic experience. Erica and John Paul for ensuring our students have the support they need to make the most out of their academic and social experience in the context of so many constraints. And thank you, Mary, for reminding us about the importance of creating a culture of care for all of us, faculty, staff, students, and wonderful wellness activities and commitment to professional development. Francis and Tessa, I love Louis Pasteur's quote, "Fortune favors the prepared mind," and reminding us of the importance of health check-ins and operational planning. And Julia, always, ETS never ceases to amaze me on the technological innovations, and I have taken advantage of breakout rooms. So it looks like we have a question coming in. Do we have an idea about when the commencement plan for May 21 will be released? Thanks for asking that question. We're hoping in the next couple of weeks that we will be able to make an announcement. We're working with the state. We have a plan and an idea, and we're hoping we can get approval for that. So more to come on commencement. And as soon as we know, we will make sure there's a community announcement made. I can take maybe one or two more questions. And as I'm waiting for that, I also wanted to, as President Garamella did, congratulate Staff Council on the 50th anniversary. It's incredible. And let's make sure on those respite days we have our students take care of themselves. Any other questions coming in? Okay. John Paul's presentation said BIPOC students don't feel supported and lack clothing and food. Are there ways that staff can contribute and donate to this? John Paul or Erica, is there something you want to offer to the community? I know certainly offering things to the Rally Cat cupboard will help with food, but are there other suggestions you have?
That might be a good question to circle back to the Mosaic Center for Students of Color. You know, I know some of that came up in a conversation around, you know, we're pushing in students to be outside a lot, and you know, not all students have what they need to be outside a lot, and that was sort of where that came from. But I think that I would look towards that office, Erica, unless you think differently.
John Paul, I was going to say the same thing. I think that office has such close and strong relationships with the communities they serve that they would be in a really good position to initially answer that question. I will also say that Rally Cat's cupboard, while focused on food insecurity, there's a great community of people involved in the planning and ongoing support of Rally Cat's cupboard, and I think that a question like that might be posed to the folks who are involved in supporting Rally Cat's cupboard as they have their finger on the pulse of larger needs that exist and opportunities for contributions.
Okay, thank you so much, and we'll make sure we take that back to our colleagues in the Identity Center and Rally Cat's cupboard. I think probably the last question we'll be able to answer is the twice weekly testing required for all students or just on campus students? I've received emails from our remote Burlington, South Burlington, and Winooski remote learners who do come to campus for other testing who are thrown by the 2 times a week. Gary, do you want to address that? I know there's some exception process if students are not around, but in the local area, I do know any student who's coming on campus, we were expecting twice weekly for the next couple weeks, but go ahead, Gary.
That's correct. Anybody who is required to test has to test twice weekly for the next 2 weeks. If there's extenuating circumstances that prohibit them from doing that, in the message we sent out yesterday, there was a link to complete the exemption form. So they should be referred to there. But yes, anybody who is required to test every 7 days is now required to test twice weekly over the next 2 weeks.
Thanks so much, Gary. I wanted to make sure I had that right. And thanks for the questions. We hope next time we'll be able to answer more questions, but I think you agree that we had some incredible information that was very helpful. I actually always learn at these staff live events. And just to let you know, we are working on fall planning. The spring planning team is looking at summer and now looking at fall planning, and my hope is that we are able to have more in-person classes and continue to expand our high quality online classes, but you'll be hearing more about fall planning as we observe what's happening in the community. Thank you for your diligence in keeping everybody safe, and I know some respite days are coming up. Encourage our students to take rest time and take care of themselves for those days. And please remember the things that Francis said. You know, wash our hands, masks, social distance. If we do those things and don't engage in social gatherings until we get through this tough time, it will keep us all safe. Thank you all for participating, and I look forward to seeing you again, and in the future, I hope in person. Thank you all to the panel as well.